Welcome to Sex Ed with DB. I'm your host, DB. Let's get into it. Let's be honest, your shower has been strictly business. It's time for some actual pleasure in there. Enter the Magic Wand Waterproof. Same iconic deep rumbly power, now cordless and fully waterproof, which means shower, tub, pool, cold plunge, all fair game. You've got 4 intensities, 4 patterns, that soft silicone head, and the flexible neck that knows exactly what it's doing. If your shower routine could use something unexpected and delightful, this is it. Find the amazing Magic Wand Waterproof on their Where to Buy page at magicwandoriginal.com/where-to-buy. Today's episode is brought to you by Rula. If you've been thinking about starting therapy but keep talking yourself out of it, then Rula is the platform for you. Rula makes accessing quality mental health care easy and affordable, with sessions costing an average of $15 with insurance, and appointments available as soon as tomorrow. Rula also accepts over 120 insurance plans. It's simple to sign up, see your cost, and find a provider in as little as 5 minutes. If you're ready to make progress, head to rula.com/sexed. That's RULA.com/sexed and take the first step. I've been a sex educator for almost a decade, so I know lots about sexy products. Let me share my top 3 reasons I'm personally obsessed with Uberlube. 1, sex feels better while using it, period. 2, it's great for sensitive skin and it's recommended by leading doctors. 3, I don't need to reapply it often because a little goes a long way. Go to uberlube.com and use code SEXEDWITHDB for 10% off at checkout. If you've ever thought, I kind of want to try a suction toy, but I have no idea where to start. Hi, this is for you. Lem from Nancy is the perfect first step. It's designed to feel safe, simple, and actually enjoyable to use. No confusion, no intimidation. You can start slow, explore what feels good, and stay in control the whole time. And because it's small, quiet, and super discreet, it literally looks like a lemon, it doesn't feel like this big, overwhelming thing. It just feels fun. So if you've been curious but hesitant, this is your sign. Go to hellonancy.com and use code SEXEDWITHDB for 25% off. Hello, and welcome back to Sex Ed with DB. I'm DB, your favorite sex educator and pleasure expert. And today we are answering a question that has probably entered the brain of nearly everyone with a penis, and probably many people who have sex with people with penises, which is, how long should it take to ejaculate? And what actually counts as premature ejaculation? Because depending on where you learned about sex, probably porn, you might believe that quote-unquote good sex means that you have a rock-hard erection for an hour, or at least 45 minutes, with a bunch of position changes during sex, and you're able to maintain it the entire time. But we're gonna get real today, and we're gonna get some shit straight. We are getting into a bunch of stuff. What the research says about average ejaculation time, and you're gonna hear a lot of me thinking and referencing the Mayo Clinic in this episode. So again, prayers up to the Mayo Clinic, thank you. We're also gonna get into why there is no medically required amount of time that sex quote unquote should last. We're going to talk about what premature ejaculation actually means, the difference between lifelong and acquired premature ejaculation, why timing alone doesn't determine whether someone has a sexual dysfunction, why current research leaves out a whole lot of non-penetrative sex and queer sex, what can contribute to ejaculating sooner than you want, and what evidence-based treatment options exist. Let's get into it. So, before we discuss averages, we need to define what researchers are actually measuring. And a lot of the major studies use something called intravaginal ejaculatory latency time, or IELT. IELT means the time between vaginal penetration and ejaculation inside the vagina. In some studies, a partner literally used a stopwatch. Now, the important limitation is that this measure only captures one specific kind of sex, which is penis in vagina penetration. It does not tell us how long it quote unquote should take to ejaculate during masturbation, oral sex, anal, hand stimulation, toy use, or any sexual experience that does not involve vaginal penetration. So when you hear numbers about the quote unquote average time to ejaculation, you are usually hearing about vaginal intercourse. So what is the average? One large multinational stopwatch study found that the median time from vaginal penetration to ejaculation was about 5.4 minutes. Another study found a median of about 6 minutes. But here's the detail that really matters. There was enormous variation. That's why it's important that we recognize that we're talking about medians here. In the first study, times range from 30 seconds, roughly, to more than 44 minutes. So when the Mayo Clinic says that the average is around 5 minutes, that doesn't mean that 5 minutes is the correct amount of time. It also doesn't mean that 4 minutes is somehow a failure, 6 minutes is wonderful. It just means that 5 minutes is near the midpoint found in certain populations during a specific type of PV sex. But average doesn't necessarily mean ideal, because we're talking about sexual satisfaction that's more important here. But we'll get into sexual satisfaction in a bit. So let's transition to premature ejaculation. What counts as premature ejaculation? Premature ejaculation is not simply ejaculating sooner than your partner, and it's not having one sexual experience where you were extremely turned on and you came in 45 seconds. The Mayo Clinic describes premature ejaculation using 3 important features. First, the person ejaculates within roughly 1 to 3 minutes of penetration, always or nearly always. Second, they're unable to delay ejaculation during sex all or nearly all of the time. And third, it causes significant distress, frustration, or avoidance of sexual intimacy. And that third piece really matters. I feel like we learned from Dr. Nikki Prowse that, if you're someone who doesn't want a girlfriend, that's not necessarily a bad thing. We don't need to diagnose people with depression if they just say that they are not really interested in that. So the same, logic applies here. If you're ejaculating quickly and you aren't feeling distress over that, that doesn't necessarily matter all that much to you. And therefore, you might not qualify as someone who has premature ejaculation. So again, that third piece really matters. You can ejaculate quickly and feel completely fine about it. And your partner can also feel completely fine about it. Maybe penetration lasts just 1 minute and then you spend another 20 minutes using your mouth or toys or hands. And that's not necessarily a disorder. Diagnosis is not only based on how many seconds pass before ejaculation happens, but it's about control, consistency, change, and of course, as we just said, distress. Also, a few questions that you might want to ask yourself. Can I delay ejaculation when I want to? Or does this happen almost every time? Or is this different from how my body used to work? Or is it meaningfully affecting my well-being or relationships? So just a few questions to ask yourself to see if you qualify in that zone of premature ejaculation. So let's talk about lifelong versus acquired premature ejaculation. Clinicians generally distinguish between these 2 major types. Now, lifelong premature ejaculation means that the pattern has existed from someone's earliest sexual experiences. And the International Society for Sexual Medicine describes lifelong PE as ejaculation occurring before or within about 1 minute of vaginal penetration, along with difficulty delaying ejaculation and negative personal consequences. Whereas acquired premature ejaculation, this is when someone has previously had a different level of ejaculatory control and then experiences a noticeable and distressing change. Again, here with the word distressing. For example, someone previously ejaculated maybe after 8 or 10 minutes of penetration, and they are now consistently ejaculating within 2 minutes and feel unable to control it. For acquired premature ejaculation, the important issue is not only whether the person crosses this universal time limit, but it's a change from their personal baseline. Clinicians should not only ask, how long does it take, but what was normal for you before. So that's another way to think about premature ejaculation. The Mayo Clinic notes that it's typical to experience early ejaculation sometimes. And here are a few of the reasons why that might happen. You maybe haven't had sex in a while, you're having sex with someone new, you're super intensely turned on, or you're nervous. The stimulation might be different. Maybe there's a new position. And one fast ejaculation does not equal a diagnosis. Remember that I mentioned, nearly all the time that this has to be happening. Human sexual response varies from encounter to encounter, and the medical concern is a consistent pattern that feels difficult to control and causes distress, not the occasional or enthusiastic premature ejaculation. Let's talk about what can cause or contribute to premature ejaculation, because the exact cause is not actually always clear. Back to the Mayo Clinic, thank you Mayo Clinic, describes premature ejaculation as involving a complicated interaction of psychological and biological factors. So some of those psychological contributors may include the following: performance anxiety, stress, depression, relationship difficulties, sexual shame or guilt, early sexual experiences where someone learned to rush, and anxiety specifically about ejaculating too quickly. And that last one can become a very frustrating cycle where you worry you're gonna come too quickly, and that makes it harder for you to relax. You become hyper aware, and then you ejaculate quickly, and then your brain is like, well, you did it again. And that can be stressful, that can be challenging. Erectile difficulties can also interact with premature ejaculation. So someone who's worried about losing their erection might rush towards ejaculation to make sure it happens before the erection goes away. Possible biological contributors can include differences involving hormones or neurotransmitters, inherited factors, or inflammation or even infection involving the prostate or the urethra. And acquired premature ejaculation can sometimes be associated with a health change, medication change, erectile dysfunction, stress, or relationship context. And this is why a sudden change in your ejaculation timing is worth bringing up to a healthcare provider rather than immediately purchasing some sort of medicine or over-the-counter thing. Because you want to make sure that you're sharing all of the context with the provider so they can provide you with some information as to why this might be the case for you. Now I want to address why people are so often worried about how long penetration lasts. A lot of people with penises believe that they need to last longer because they feel responsible for making their partner orgasm through penetration, but if you listen to the show, you know this very well. Many people with vulvas do not orgasm from vaginal penetration alone. For most, clitoral stimulation is essential. So making penetration last, 20, 25 minutes doesn't automatically solve the pleasure problem. In fact, it probably won't. So the better question isn't, how do I prevent ejaculation for as long as I can, but rather, how can we create a satisfying sex life that doesn't depend entirely on how long my ejaculation timeline lasts? And that can include all sorts of things: clit stimulation before, during, or after penetration, oral, hands, toys, taking turns, continuing pleasure after ejaculation. And as we talk about all the time here, penetration does not have to be the main event, and ejaculation doesn't have to be this be all end all of sex. But if you are someone who is struggling, or someone, a partner, a friend perhaps, who is struggling with premature ejaculation, you should know that it is treatable. There's tons of research, of course, that has gone into this, and the Mayo Clinic lists behavioral approaches, medication, counseling, and a combo of these things as treatments. And a healthcare provider might discuss the following techniques. So the first one is the stop-start technique, aka edging. So this involves pausing stimulation when ejaculation feels close, allowing arousal to decrease, and then beginning again. There's also the pause squeeze technique, which involves pausing, briefly squeezing the area where the head of the penis meets the shaft until the urge to ejaculate decreases. And to be clear, no one should squeeze the penis too hard. So please do this softly. There's also pelvic floor training. Some evidence suggests that pelvic floor exercises may help some people improve ejaculatory control. This is an area where working with a pelvic floor physical therapist may be more helpful than just, doing this on your own accord. Pelvic floor muscles can be weak or tight or uncoordinated or some combination of those. And so you want to work with a healthcare professional like a pelvic floor PT to try to get some good exercises for your body. There's also condoms or topical anesthetics. So thicker condoms or topical products containing lidocaine may reduce penile sensation and delay ejaculation. There are products that are like delay spray that can reduce sensation for a partner if they transfer. So it should be used according to medical directions. Make sure you clean it off and pair it with barriers when appropriate. And there are some prescription medications. So some antidepressants, especially SSRIs, can delay ejaculation as a side effect. And the Mayo Clinic notes that duloxetine is used in some countries, but it's not currently available in the US. So if you're interested to learn more about that, you can check that out. Some medications used for erectile dysfunction also may be helpful, particularly when erectile difficulties and premature ejaculation occur together. But again, this is important for you to chat with a healthcare provider about. Please don't go ordering random medications off the internet. I'd like you to stay safe and informed. And finally, counseling or sex therapy. Counseling may help address anxiety or shame, stress, relationship dynamics, or certain patterns that might reinforce the issue that you're having. And the Mayo Clinic notes that counseling may be particularly helpful when combined with meds. So to kind of wrap up a bit here, when should you talk to a healthcare provider? When is it time for you to seek extra help? If you ejaculate sooner than you want to during most sexual experiences, feel consistently unable to delay ejaculation, you avoid intimacy because of it, you're feeling distress, frustration, or shame, your ejaculation timing has changed suddenly, you are also having difficulty getting or maintaining erections, if there's any pain, urinary symptoms, or pelvic discomfort, or you just really want support, a provider may ask you about your sexual history, whether the pattern happens during certain kinds of sex like masturbation or partnered sex, or if it occurs with every partner or just certain partners, whether it's lifelong or new, and how much distress it causes. Most people, when they make a healthcare appointment, they might feel embarrassed about this, but I want you to know this is a very, very common issue. You don't need to feel embarrassed about taking care of your health. So here's what I want you to take away from this episode. There is no perfect amount of time that ejaculation is supposed to happen. Research puts that midpoint for ejaculation during vaginal intercourse at roughly 5 to 6 minutes, but people vary enormously. Also, premature ejaculation is not defined by timing alone. Again, it has that repeated pattern of ejaculating sooner than desired, difficulty delaying it, and meaningful distress or negative consequences. And sometimes ejaculating quickly is just normal. Sometimes it happens with a new partner when you're really excited. And sometimes it's just connected to other mental health things like anxiety, stress, or erectile difficulties, relationship dynamics, physical factors, or a combo of things. And if it is causing distress, there are treatment options available for you. And I want you to know that being really good at sex is not necessarily tied to delaying ejaculation, and definitely not delaying it indefinitely. It means being attentive, communicating, giving your partner pleasure, consent, knowing that penetration is not the only path to orgasm. And for women and people with vulvas, it most likely is not. And if it is, that's great. But for most people, it's not. And just understanding that ejaculation may be the end of one activity, but it does not have to be the end of sex. Your body is normal. You are doing great. I just want to support you as your sex ed podcast pal. And for you to remember that your sex life should not be measured in minutes. It should be measured in pleasure. Thank you so much for listening. Love y'all. Talk to you next week. Have you ever wanted to immerse yourself in Wonder Woman's Amazon tribe, or the setting of the movie Atlantis, or the bisexual bliss of the Mummy, curse and all? You've found your queer history girlies in Spirits, Mythology, Legends, and Folklore. Spirits is a weekly podcast where mythology buff Julia explains a different story from an ancient myth or modern folklore to her childhood BFF Amanda. They examine these stories through a queer feminist lens, drawing parallels to modern life and asking why these stories still matter to us as human beings. It's like a cocktail party where you get to learn something, laugh a lot, and think about death, but in like a fun way. Once a month, they also tell spooky stories from listeners' hometowns. So if you like a good ghost story, start with the Your Urban Legend series. Haunted Old Spaghetti Factory, anyone? Listen to Spirits, Mythology, Legends, and Folklore in your podcast app every Wednesday. Search their archive of over 500 episodes, including full transcripts of each at spiritspodcast.com, and check them out at our link in the show notes. And as they say on Spirits, stay creepy, stay cool.